Hi everyone, welcome to my channel. Today we will be talking about retinoid and its side effects. That how do you handle that? It can be skin darkening, purging and all of that. I'm going to talk in this video. So let's start about. So number one thing is that when you start with retinoid, you will see that there will be skin purging. That means you'll see more of the acne, your black hairs, white hairs, all of that being more visible. That means everything is being pushed out and your skin is clearing out. That will take to settle around 2 to 4 weeks. That's that. Another thing I want to tell you here is that there are many people who have had severe swelling also as a side effect of using tretinoin. So what you should do is always when you start using it, two patch test, like put it little bit around your, behind your ears, and so leave it for around 24 to 48 hours, and then you see how your skin behaves, because it's very, very risky. Otherwise, it might cause severe swelling. So another side effect that you would see is skin peeling, that you would feel that your skin is like kind of coming off. So when that is happening, for me personally, that was a very satisfying kind of phase, because I could actually see things working and I felt like something is happening. But other people, some of them might not feel that comfortable, or especially like now that we have started going out, and there will be days when we want to dress up or so, and then there's this skin peeling happening, and that can look weird, like your makeup won't go on well, and there might be discomfort, irritation, itching and all of that. So in that scenario, what you have to do is, number one, very important to keep your skin moisturized all the time. So keep a moisturizer handy with you. Use something which does not have any actives, very gentle moisturizer. You could use Aqua Oat, you could use Cetaphil, you could use that Cepicum from this one Minimalist. You could use all of these soothing moisturizers and keep on reapplying them after a few hours to keep your skin hydrated. That is very important. Another thing that you could do is you could go for essences or toners which are filled with hyaluronic acid to keep your skin moist and hydrated, and do apply all of this on damp skin. You spray a little bit of face mist, any toner, and then you apply another layer of good thick moisturizer, and then you leave it on. Another thing that you can do is, like if you're having severe dryness and peeling, is applying a thick layer of moisturizer as a mask. Like imagine you washed your face, and after that you would apply like a very thick layer of this moisturizer onto your skin, and then leave it on there. After a few minutes you will see most of it will be absorbed by your skin, and whatever is left, just gently massage it into your skin. That will help in curing extreme dryness or irritation. Then sandwich method is that which I have talked about earlier also many times, is that first you apply your moisturizer, then you apply your tretinoin, and then again you apply another layer of moisturizer. That is also a very good way of dealing with dryness and irritation. Now let's talk about skin darkening, which is all big side effect of tretinoin that I have seen many people have that. So what do you do about that? Number one thing is that skin darkening can happen due to three reasons. What you have to do here is, number one mistake that you have to avoid is, don't directly start with this unless and until your doctor has prescribed you. Start with retinols, and retinols are easily available over the counter. You could go with Neutrogena, you could go with Olay, you could go with Minimalist retinoid. You could start with something which is of a very low concentration. You could start with Eclat. I really like their retinol also. So you can start with these and slowly build up to the tretinoin. Don't directly jump to these. It will cause skin darkening. Number two thing that causes skin darkening is that you are using too much of the quantity. So when I talk about the quantity, I've talked about this, that you have to use very less quantity, like this much pea size amount. This much you have to use, not more than this. And that also, don't rub it onto your skin. Apply it in a very gentle strokes like this, and leave it like this. Spread it like this and forget about it. Don't rub it like this. That way also skin irritation will increase, and you will have dark patches and that skin darkening problem. Number three, that a lot of people do this, is that they will apply a lot of tretinoin very frequently. Like normally you have to start tretinoin like once a week, and sometimes what you can do is, you can in fact do the contact method. So what you have to do here is, like you apply the tretinoin after washing your face. After 30 minutes or so, you apply a layer of it, You keep it on as a mask for around 30 minutes and then you wash it off. That is called a contact method. That way, what you can do is, if you are a beginner and you have sensitive skin, or someone who's very scared to use retinoid, you start with this contact method. One day you do this for 30 minutes, remove it. Then after a few days, you keep it for 1 hour and then you remove it. Like that, you can build up to keeping it overnight. That also you can do. So that way what will happen is your skin will get used to like how to process the retinoid onto your skin, and then skin darkening won't happen. Another mistake that a lot of people do is that they will apply the retinoid immediately after washing their face on damp skin. So what happens is, when you do that, your skin is very much ready to take in deeper whatever you have applied onto your skin. So your retinoid will go much more deeper, it will be more concentrated, the effect of that, and that also can cause irritation and skin darkening. So be careful there also. They don't apply immediately after you have washed your face. Don't apply it on damp skin. Another thing that people do is that they'll directly jump to 0.5 and they'll not even use 0.025. So start with this one, 0.025, and then you can move on to 0.05. That way you will not be using a very high concentration, which can also cause skin darkening. Now the question is, what should I do? Like, if I have skin darkening, how do I heal it? Number one thing, stop using retinoid immediately. Give your skin a break. Even you should give break to any AHA, BHAs or salicylic acid. So what you will do is, you will start using vitamin C in the morning, but the vitamin C should not be L-ascorbic acid, because that can sensitize and irritate your skin. Instead, use the ethyl ascorbate one, which is much more gentler, and all the skins can, actually take it. That is number one. Number two, don't forget to use sunscreen. Now sunscreens also, when you're using here, try using tinted sunscreens, or you could use a BB cream over your sunscreen, because when we use iron oxide, that helps in preventing any of the pigmentation that you might get with the help of visible light. So do use sunscreen for sure, and reapply it after every 2 to 3 hours. Don't forget that. That is very important. Another thing that you could do is, you could use Cica, which is Centelastica. That kind of creams or moisturizers which have that ingredient, you can use that. I will link few of the creams in the description box. You can buy those and you can actually soothe and calm your skin with Cica. That is also very good. And after a few days, you will observe that your skin will start getting back to its original color, that you have stopped using retinoid. Then if you really want to start again, please reduce your frequency, reduce the strength of the retinoid, and make sure you don't apply it on damp skin, and don't apply it a lot. Very little, or you could use it contact therapy. And if the darkening is severe, make sure that you're checking with a dermatologist and get yourself treated from a professional. So these were some of the tips that I wanted to share with you with the side effects of retinoid. I hope you liked the video. If you have any other questions, do let me know, and I will share with you that in another video. If you have any other video ideas, do let me know that also. Take care. Bye.